Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we have the pleasure of speaking with Ann Marie McDonald, who is the Chief Nurse Executive and Vice President of Quality and Performance Improvement at the Hospital for Special Surgery, about her career and her thoughts about trends in the nursing industry. So, hi, Ann Marie, how are you?
Hi, G. Thank you for having me. I'm very good. Thank you.
Of course, and thank you for taking the time. Right off the bat, congratulations on your new role. You let me know you're official now, no
Yeah,
longer interim, so congratulations.
thank you.
Yeah, of course. So we're gonna jump right in. How did you begin your journey into nursing?
Well, my journey started several decades ago in 1986. And as you can tell from this accent, my journey originally started in nursing in Scotland. I graduated from a diploma program from Glasgow Eastern College of Nursing. And this
Mhm.
was a hospital based program with much of my clinical experience conducted in hospitals located in or around Glasgow, the city of Glasgow. The hospital was known as Glasgow Royal Infirmary, the main campus, known locally as the Royal to many of Glaswegians and local Scots. And
Mhm.
that's where I received education and clinical experience in medical surgical, operating room, maternal, oncology, pediatrics, behavioral health.
Mhm.
While at the Royal, I stayed in hospital accommodation. This is just a side note and story. And this was connected to the main hospital through a greenhouse corridor. It was covered in glass. And it was really a way in which the matrons of the nursing matrons of the hospital could watch you going in and out, and
Mhm.
that there was no unauthorized visitors. So my career started very early in my graduated very early in the 90s. And then that's where my US experience began. I moved to the United States in
Mhm.
1992 when the US was experiencing a shortage of nurses and there was an
Mhm.
international recruitment. And that's where I followed suit and came here in 1992. So that was my beginning of my journey in the United States.
Very cool. And just out of my own curiosity, is there kind of a different vibe in nursing in Scotland versus the US? I'm curious.
Well, that was many moons ago, many
Mhm.
decades ago. And being a diploma nurse, you were very hands-on. It was
Mhm.
several weeks in class and then practical for several weeks after that. And you really had experiential, hands-on approach.
Mhm.
In nursing in Scotland back in the late 80s and 90s, there was much of a focus on cleanliness and our patients, prevention of injuries, prevention of falls. So very similar to the United States in terms of outcome.
Mhm.
But at that point in time, you were assigned to many tasks, and some of the tasks were very much about the environment, the cleanliness of the environment in relation to patient care. So
Mhm.
coming here in the 90s was a little bit of a difference in the environment. I came to an emergency room in an academic medical center in New York City, and there was just a little differences in the way the environment certainly was approached from our nursing perspective and
Mhm.
overall experience for our patients, just a little different.
Absolutely. So who have been some of your biggest career influences?
I think beginning in terms of my nursing journey, there was a clinical instructor. Her name was Mrs. Wall, and she was very influential to me during that process and really supporting me through some challenging times during the experience part of clinical placement and really help guide me and mentor me through the program. So she really became my first mentor and someone that I connected with after graduating and really took me through that process. Later on in my career, I went on to do a master's and doctoral education at Teachers College, Columbia University. And one of the professors who became my doctoral advisor, Dr. Elaine Monica Rigolosi, was really influential in my leadership career. And she really put me through a process to ensure rigor, academic rigor, and resilience that translated into my leadership abilities. But this was really through the doctoral degree and the doctoral process. And that was over several years. Unfortunately, both Miss Waugh and Dr. Elaine Lamonica Rigolosi have passed away, but they were very influential in the beginning of my career as a nurse through support and mentorship towards a doctoral program and leadership abilities, capabilities through rigor, academic application, and resilience.
Absolutely. Well, I'm sorry to hear that they've passed away, but I'm glad they had such a big impact on your career. That's amazing. So, what was your best mistake and what did you learn from it?
I like to think of mistakes as opportunities and really not as mistakes. So there's been many opportunities throughout my career that have led to learnings or led to process improvement or leading to better outcomes as a leader. Years ago, through just through opportunity, I was able to move from a staff nurse position to a clinical coordinator, which was an entry level nursing manager's role. And one day I was a peer with my other nurses, and then the next day I was supervising the nurses. And again, there was no formal training at that point in my career. So being able to understand the value of having the right skills, the right knowledge, the right abilities to lead others is very important and very important for all nurse leaders. And that experience led me to seek formal and informal classes and structure where I was able to build strength in my leadership abilities. But then I went on to, develop in master's program and doctoral program at the nurse executive program at Teachers College. So formally build upon that. But that was a little later on in my career. But it really led me to understand the value of being able to build talent within and talent outside, the right person, the right knowledge and skills and inner values of people that we see talent in to help guide them through the career ladder of nurse management and opening those opportunities to move them forward through that ladder and through mentorship.
Hmm. Absolutely, yeah. So, what do you think are some of the biggest challenges that are currently facing CNOs and CNEs?
I think some of the biggest challenges are workforce shortage and retention, and
Hmm.
nurse well-being, and obviously there's some financial pressures in the climate that we're in today. As we think about workforce shortages and retention, and that really thinks it makes me think about HSS and what we're doing at HSS in terms of keeping up with change and how nurses, we all tend to keep up with change, is how we're building forward and
Hmm.
building forward with our recruitment and retainment strategies and our succession planning. And typically for recruitment strategies, typically through job fairs or our LinkedIn ads. But succession planning for me at HSS is about building this magnet to attract nurses to our organization, and how we can develop a proposition that really is compelling to the best nurses in the world. And this is a journey, and this is a journey that I'm on, and more to be determined in relation to that for recruitment and retention of our nurses.
Absolutely, and I'm glad you mentioned succession planning. In speaking to a lot of other CNOs, that's definitely at the forefront of everyone's mind. I think as we have 5 generations in the nursing workforce right now, which is crazy, and there's a lot of more tenured nurses who are planning on retiring soon, and not as many nurses who are entering the workforce. So that's a very important thing right now. So how do you think other CNOs can incorporate succession planning into their workforce strategies, and how can they also boost their recruiting strategies in sustainable ways?
Yeah. I think again, it comes back to, not just keeping up with changes, but really building forward. And that
Mhm.
means structures and processes that are reversed engineered and engaged in outcomes that advance in our field. And for us in building forward, at HSS, we have developed a Leadership Development Institute. So being able to prioritize leadership development, we are committed to that at HSS, to being the best in the world within this framework, and really allowing our most trusted profession to move forward through building those capabilities from a leadership perspective. So I think number one, look within and build the structures and processes around your succession planning to enforce and engage your nurses in development. I forget the second part of your question there, G. I'm sorry.
Oh, that's okay. It was just how do you think CNOs can also boost their recruiting and retention strategies in ways that are sustainable now?
Yeah, I think that's looking at other recruitment opportunities beyond the LinkedIn and the job fairs, and really having that proposition or that value prop in terms of why nurses should come to your organization and what is that for you, and who do you want to attract and why should they come to you? And again, multi-generational engagement, understanding who the nurse of the future is, Gen Zs, what it is that they want, and again, building trust, listening to them, and being able to recruit to the needs of what the generational nurse may want.
Mhm. Absolutely, yes. And as a member of Gen Z myself, I know that the expectations have changed a lot over time, especially in the workforce. So it'll be interesting too to see what the next generation after mine expects out of the workforce, especially because of all the introduction of um, new technologies, which brings me to my next question. On the technology front, where do you think AI will fit into nursing workflows at the bedside and beyond?
And beyond, yes, that's a great question. We are absolutely committed again to building forward within the AI structure. And what does that mean for us here at HSS? I think our nurses today are not working to the top of their license, and they're not working to the top of their license because there's many demands within their day to day that don't allow them to do so. So by incorporating the innovation strategy within the nursing plan, really, and setting structure around that, where we can get our bedside point of care nurses and our leaders to evaluate what technology is out there and put our structure and process in place that the technology can complement or augment our workflows and keep the focus on human-centered AI and what that means for our nurses in the day-to-day. And again, allowing them to get back to what we want to do most, which is be with our patients, and
Mhm.
then take away some of the other demands that may be causing barriers to supporting their personal excellence and achievement. And again, I think that's really evaluating and having a formal structure and process and engagement of all nurses at all different levels in how we can introduce AI into our workforce. And again, through measurement and iterative processes, but keeping it centered around the human-centered approach.
Mhm. Absolutely. And I know a lot of nurses are a little bit worried about, job replacement with AI. So would you have any words of encouragement for nurses who are worried about that in regards to AI?
There's just one story that I heard recently when ATMs went into the banks. And this is
Mhm.
from years ago, that there was a huge worry that the job of the teller would then, the bank teller would disappear. But that's
Mm,
not what happened. Bank tellers increased because they were allowed to get back to doing what they did best. And the
mm,
ATM removed some of the barriers that took them away from what the demands or the job value was. So I think for nurses, I wouldn't be too scared, again, from an approach of what augments or complements your practice as opposed to what's replacing. And we have to have a seat at the table to determine what those AI solutions are, or those AI tools, and again to keep us keep our workflows to being back at the bedside and beyond. And that's where AI fits into the nursing workflows that I see.
mhm. Absolutely. And I love that story about the ATMs. I think that's a great analogy and a parallel to draw here. Um, so, kind of on a little bit of a different note, especially in the United States, there have been a lot of policies recently on a federal and sometimes state level that have been impacting the nursing workforce. And now more than ever, it's important, as you're saying, for nurses to have a voice at the table. So how are some of those recent changes to national policy impacting the nursing workforce and the financial well-being of hospitals? And what can CNOs do to advocate for that?
Yeah. I think from the perspective of a hospital for special surgery, we recognize that there has been some seismic changes happening that do create challenges, but they also create some opportunities for our nurses too. We recognize that there's been a shift in site for surgeries from inpatient to ambulatory. And that challenge in itself requires evolution and adaptation, and sometimes that can be hard. And what we're doing at HSS is really making musculoskeletal health more accessible to more people. And our nurses are key to this shift. Again, this shift from inpatient to outpatient. And several years ago, HSS was one location in the Upper East Side, and now we have over 20 locations throughout the tri-state area, New Jersey, New York, and Connecticut. So really thinking about care delivery processes in relation to the care you deliver to your patients based on what type of hospital setting you're in. Obviously, there's financial pressures that we all face. And as a CNO, being very mindful and responsible to those financial pressures, and creating structures and processes that allow for accountability and transparency on of your finances within nursing, cost of care, overtime spend, etc., and sharing that bidirectionally to the point of care, CNE, and having transparent methods of sharing those financial challenges that hospitals may be facing, and allowing staff to help solve for this too. And it's very important to stay engaged externally with our outside agencies and advisory councils, again, to have a seat at the table when there
Mm,
is proposed rules or proposed changes that may impact the nursing profession. And that advocacy is very important for the CNO or the CNE to have a seat at the table and to have a voice to represent and advocate for nurses as a whole.
mm. Absolutely. So to pivot back to you personally, what are you most proud of?
what am I most proud of? Oh, there's many, many things. Here at HSS, I am most proud of this nursing department. I am very proud and honoured and humbled to be leading this department. Our nursing care here at HSS is excellent. And I'm very happy and proud to say that in December we received our sixth magnet redesignation.
Wow.
And really, this was outstanding. And that being recognized, and we have earned the nation's top honor for nursing excellence from the Magnet Recognition Program of ANCC. HSS is the first hospital in New York State to receive magnet status 6 times, and we are the first hospital in Manhattan to earn that coveted status in 2002. So this is extremely rare to achieve 5 or more magnet designations, with a small percent of hospitals nationwide to have at least 6. So for me, this is what I am most proud of.
Mm. Absolutely, and congratulations. That is an incredible feat. That's amazing. So my last question for you is, do you have any advice for CNOs or CNEs?
Do I have any advice? Cultivate your relationships and build trust. What that means for me at HSS is really being present and visible. I round with our nurses frequently. I have clinical days where I'll put on my scrubs and walk side by side with our nursing staff. And this gives me really a way to foster communication, build trust, and understand what is happening at the point of care, what barriers may be there that I can help support to remove, or what day to day challenges our patients may be facing. Really, you highlighted succession planning and recruitment and retention. That is another area that I would advise to build your sustainable workforce and have a strategic plan and roadmap and KPIs around that. And be an advocate, be the voice of nursing at the executive level. Always prioritize patient safety, always be patient first and staff always, and invest in your nursing education. And lastly, take care of yourself. It is a demanding role, and you need to have some time for your own self care.
Absolutely. I think that is a perfect note to end on. Thank you so much, Anne Marie, for your time. I'm really grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to our audience for listening. Thank you, Anne Marie.
Thank you, G. Thank you for this opportunity too.